The Affordable Care Act goes into full effect in just over 7 months, and now it appears Oklahoma will have no program in place to implement key components of that law. The remaining vehicle in the legislature to engage with the new law is off the floor and will sit in a conference committee until next year.
The Affordable Health Care Act has been opposed by Governor Mary Fallin since it first arrived on the floor of the U.S. House of Representatives. During this year's State of the State speech, the governor renewed her opposition and explained what kind of health care plan for the poor she would support.
My administration will continue to develop an Oklahoma plan that focuses on improving the health of our citizens, lowering the frequency of preventable illnesses like diabetes and heart disease, and improving access to quality and affordable health care.
Because of such strong opposition to anything involving so-called Obamacare, it took until the last weeks of the current legislative session for a bill to appear that would carry out the governor's Oklahoma plan. On the People's Business program, Representative Doug Cox, an emergency room doctor, explained Senate Bill 640 as anything like the health care law.
Participation in this is not mandatory. There's no penalties. There's no taxes for not participating. Unlike Medicaid, it has requirements that you be working or look for work. It implements copays. It implements cost containment measures. All of that is totally different than Medicaid expansion.
The governor's decision not to expand Medicaid was largely based on cost. Legislators claimed it would also increase the national debt, something Representative Cox says is not correct, unlike billions in other federal funds the state does accept.
This is the one piece of federal money that we could take that is designed to be budget neutral on the federal level. The money that we take in Oklahoma for food stamp programs, the money that we use to build this crosstown expressway in Oklahoma City and widen 44 in Tulsa, that's federal money. That may have increased the federal debt.
Despite Senate Bill 640 still being written and not released to the public, opponents on the conservative right were quick to jump on the measure. From the conservative think tank, the Oklahoma Council of Public Affairs, to internet blogs like Oklahomans for Liberty, blasting the bill as just another attempt to expand Obamacare. Even those who publicly supported the measure gave only lukewarm support, labeling it as better than nothing. Representative Cox says his bill was virtually doomed before it could even be released in final form.
This bill has been politicized. It has been unfairly labeled as Obamacare. It's been unfairly labeled as Medicaid expansion. The interesting thing is there's emails going out to that effect, and the language in Senate Bill 640 has not been released yet.
Senate Bill 640 is now in a conference committee where it will sit until next year when the Affordable Health Care Law is due to go into effect. Dr. John Schuman is a writer, internist, and medical educator at the University of Oklahoma School of Community Medicine in Tulsa. He wrote an open letter to Governor Fallin criticizing her decision not to expand Medicaid and urging her to reconsider. He says now that Senate Bill 640 is dead for this year, it ensures that emergency rooms will remain full of people who cannot get health care elsewhere.
We don't expand the insurance pool so that people can access the primary care system. They will fall back upon emergency medicine or the emergency rooms, and that will drive up cost.
The state's Insure Oklahoma plan has been the only vehicle for people who did not qualify for Medicaid to get health care insurance, and that program now has only months left in its current form. The letter from the Center for Medicare and Medicaid Services came to the state this week, denying the federal waiver that had enabled the program in the first place. But in that letter, the federal government made clear it is open to negotiations to revive Insure Oklahoma as long as it could be made compliant with the new health care law. The board of directors of the Oklahoma Health Care Authority has now seen the preliminary findings of the study by a Utah company that was hired to tell the state what it should do to improve health care insurance for the state's working poor. The findings from the Levitt Group report are in line with what Governor Fallin has wanted from the beginning. Use money that was supposed to go to expand Medicaid coverage to instead help people buy private health care insurance, much like the Insure Oklahoma plan already does. The board was urged to take up the federal government on its offer to talk about a way to keep Insure Oklahoma alive.
But it also suggests that you not just roll over on the current, the letter you just got from CMS on the extension seemed to me, as I read it, that they were leaving it open for some negotiation.
And because those negotiations will be complex, Michael Diley says it is not reasonable to expect the state to have any plan in place by January 1st, 2014.
We're suggesting that January 14 is not a realistic date. Plus, there are other issues as well. There's bound to be a lot of confusion come January of 14. There are going to be a lot of changes.
Nico Gomez, director of the Healthcare Authority, says Insure Oklahoma was a good plan, even though it was limited, and he favors ongoing talks to keep it going.
As things change and we have to adapt and figure out new strategies from a state-based solution standpoint. And we've done it before. With Insure Oklahoma is a great example. So hopefully we get an opportunity to do it again.
David Blatt with the Oklahoma Policy Institute says the Levitt plan also makes clear the state isn't going to find a way around accepting federal health care money.
The Levitt proposal looks like it's going to suggest that we expand coverage for all adults below 138% of the federal poverty level and use the federal funds available under the Affordable Care Act to do that.
And Blatt agrees January 1st of 2014 is not a deadline for the state to act, even though it would be best if it did.
If we don't act to expand access to coverage in 2014, there's still 2015 or 2016 ahead. There's a lot of reason to do this sooner rather than later, but this conversation is going to continue.
The final report from the Levitt Group is expected in June. No matter what its findings, it is now clear that whatever program is eventually put in place to help people who work but can't afford health care insurance will involve federal funding, but it won't carry any identifier that can be readily linked to the Affordable Health Care Act.
I think that if we put a part in that bill to call it Fallon Care or something like that, possibly it'll pass the legislature, to brand it something different than accepting something from Washington.